In this video, we're going to learn about cognitive processing, which is an evidence-based gold standard treatment for PTSD. It can be utilized at home without a therapist. It has helped hundreds of thousands of people and is one of the quickest and most effective treatments for post-traumatic stress. In this video, you will learn what cognitive processing is, how quickly it can relieve PTSD symptoms, and about that resource we just talked about. Cognitive processing is a form of cognitive behavioral therapy with an emphasis on cognitive. It focuses on how you think about your traumatic experiences. If you can change the way you think about these experiences, you can change the way you feel, and then the PTSD symptoms can decrease fairly quickly after that. Cognitive processing is not talk therapy. Even if you go to the therapist, you're not going to have to talk about feelings with them. It helps identify challenging stuck points or negative thought patterns that contribute to post-traumatic stress symptoms. It is recommended by the VA and the Department of Defense because it works so well for treating veterans. Cognitive processing can also treat anyone experiencing trauma from violence, abuse, an accident, or a sexual assault. It's for every trauma survivor. The following clip we're about to show is from the Guilford Press YouTube channel. It is an interview they did with Patricia Resick, which was the founder of cognitive processing. In this video, they talk about how cognitive processing can be accomplished in just a few sessions.
A few years ago, This American Life did actually an episode on CPT called 10 Sessions. And Ira Glass said, his quote was, "There's this kind of therapy where instead of taking years and talking, you just kind of bang it out in 10 to 12 sessions." I think this notion of knocking it out is very appealing to everyday readers. And I know that's not quite what it is in actuality, but how do you think that your new book, Getting Unstuck from PTSD, helps people achieve this?
Well, as I said, people can work at their own pace. So you could knock it out very quickly. We've seen people do this in 3 weeks. We've seen people do it in as little as a week with a therapist. But there's so many people who can't access therapists. And you're going to get out of it what you put into it. So if you do the exercises and you follow the book along in order and not just get through things, you could, quote, knock it out in a few weeks. It really depends on how much they avoid, whether they put it on their shelf for a while or whether they really sit down and work the program.
The book they were interviewing her about is Getting Unstuck from PTSD. It is the absolute best resource for learning cognitive processing at home. It can be learned in 5 weeks or less, but you'll want to keep working the program until the majority of your symptoms subside. This book has a self-evaluation that you'll take once a week, and when your PTSD symptoms fall below 20 points, you're done. That's it. This resource is also great for building resiliency, as you can apply these resources to future traumas when you have them. This book can only work if you wholeheartedly commit yourself to doing the work, filling out the worksheets, and analyzing your thoughts the way the book teaches you to do it. Where would you rather be in 5 weeks? Do you want to continue having intrusive thoughts or deal with that trauma on your own terms when you decide? You want to keep actively reliving your traumatic event or relocate it to the long-term memory part of your brain so you don't have to deal with it anymore? Your trauma won't just go away. You have to commit to fixing it and do something about it. Getting Unstuck from PTSD is a great place to start working on your trauma. It can be purchased on Amazon, which is available to everybody, and it just costs $24. If you get through this book and you've had several months working with those stuck points and you're still having a little trouble, you might look into ACT, though. ACT will teach you how to live your life in a meaningful way in spite of your pain. Learn about the best ACT resources for treating depression, anxiety, and PTSD at home by hitting the link here. Help us prevent suicide by sharing these videos. Also, like, subscribe, and comment to help the algorithm show this video to someone who needs it.